Welcome back, and let's pick up on the rest of our miscellaneous punctuation. Let's look at the hyphen. The hyphen and the dash are two very different types of punctuation marks, and you need to know the difference. The hyphen is done with just one hyphen on your keyboard, and the dash is typed with two of them together. And sometimes you can't always tell from the appearance of our word processor because they merge the two hyphens together that make up a dash. So the dash is a little bit longer. It's called an N dash or an M dash. Let's look at the hyphen. We're going to use a hyphen to connect two or more words that act as a single modifier before a noun. So just to step back a bit, a modifier is a word or words that describe the noun that precede it. So a rainy day, difficult situation, scenic view, arrogant doctor. Those are all modifiers of their nouns. And here are a bunch of examples of these compound modifiers of the nouns that precede it. Figure of 8 incision, figure hyphen of hyphen 8 incision. 3-ring reference binder, 3 hyphen ring reference binder. Spanish speaking patient, Spanish hyphen speaking patient. Non-English speaking patient, non-hyphen English hyphen speaking patient. And you can read the rest of them on your own, but notice when they are used to connect with a compound modifier, we're going to use a hyphen. Be careful, don't use a hyphen when that compound modifier follows the noun. Only going to use a hyphen when it precedes the noun. So please check the copyright in your dictionary to see if it is up to date. Notice up to date is our modifier of the dictionary. It is after our noun, so no hyphens. But if it was rephrased to the up-to-date dictionary, notice up hyphen to hyphen date comes if it would come before the noun. The patient is 8 years old. No hyphens. If it was rephrased to the 8-year-old patient, then we would have hyphens. 8 hyphen year hyphen old patient. So notice the difference there. Follow-up examination. Your next examination is a routine follow-up. Let's go to the next slide and take a look at this word follow-up. It's important to know the difference between follow-up as one word and follow-up as two words. Fairly new is the adoption of an adjective or form follow-up being one word as a solid word, such as the follow-up examination. There it's an adjective, one word. The exam was a follow-up, one word. It's a noun there, one word. When we're talking about a verb to follow up, we're going to use two words for that. No hyphens in either one of these, but two words for a verb. The doctor will follow up in 2 weeks. Remember, a verb shows action, and think about when you say there's going to be two words. If you hold up your fingers to two, it kind of makes a V as in a verb. So that's how you can kind of make the difference, the differentiation there. As a verb, follow-up should be two words. This is important, and you will find this probably on the midterm exam. You might find it on the final exam. So get to know the difference between follow-up, one word, adjective or noun, follow-up, two words, verb. Also to be noted is that we do not use hyphens with adverbs, and adverbs usually end in ly, so that's an easy way to remember it. So don't use adverbs with that. So excessively prescribed drug, no hyphen. Poorly proofread report, no hyphen. Exceptionally sound medical advice. Don't use a hyphen with ly adverbs. As is very common with our English language and medical language, we always have exceptions to rules, and there are a number of our common medical compounds that we do not hyphenate, such as congestive heart failure, upper right quadrant, intensive care unit, in vitro testing, low back pain, left lower quadrant. So if you're not sure, you're just going to have to look them up in a medical dictionary because they're not all hyphenated, and I know that doesn't make it easy, but just to realize that there are exceptions to all of our rules. Very closely related to the hyphen is a suspended hyphen. In a series of compound modifiers, we will use suspended hyphens. Let's look at a couple of examples of what I mean here. There were small hyphen-sized cysts and large hyphen size sis. Let's look at the next one here. There were small suspended hyphen and large hyphen size sis. Notice how after small we have what we call a suspended hyphen here. It's waiting for the other part of the modifier there. It's waiting for it to be connected, so it just sits out there and it suspends. Look at the next one. Your 2 suspended hyphen, comma, 6 suspended hyphen, comma, and 12 hyphen month follow-up exams have all been scheduled. So notice again the 2, the 6, we've got our suspended hyphens there waiting for the rest of the modifier month to show up. So that's what the suspended hyphen is all about. Other uses for hyphens with compound numbers from 21 to 99 when we write them out in words, such as 80-5% was the average score. Now, of course, we really don't like to start a sentence with a number, but just for purposes of example here, 85 hyphenated. Once in a while, we do write out our numbers, and we would use hyphens for that. We use hyphens with letters or words describing chemical elements, with the exception of when we might have superscripts or subscripts, such as 131I, 131-I, uranium-235, uranium-235, and so on. We should use a hyphen to replace the word to when we're talking about a range, such as floors 2 to 4 or sections A to C. Note, though, that we should never use a hyphen to represent the word through. There's a little bit of a difference there. We also use hyphens with single letters in coined words, such as X-ray, T-shirt, S-shaped, T-cell, and so on. As previously stated, hyphens cannot be used to represent the word through. Take the medication on days 1 through 7. We want to make sure just that it's as distinct and clear as possible when we're using the word through. See me again in 2 to 3 days. That one's fine. We can use a hyphen because it's representing the word to. A few other hyphen uses with compound nouns and names, such as Mary Connors Davis is the secretary treasurer of the Milwaukee chapter of AHDI, or the Wisconsin Minnesota Association for Medical Transcription. So with compound nouns and names, use hyphens. We'll use hyphens when there is a prefix before a proper noun, such as anti-American, mid-October, pro-Medicare. Again, remember, proper noun requires capitalization, so we're going to use a hyphen in between the two. We also use hyphens to avoid some awkward or confusing letter combinations, such as anti-immune, rather than having the double I's together. So again, check your dictionary if you're in doubt. We also use hyphens to differentiate meanings. Are we talking about recollect or recollect? Recover or recover? Resign or resign? Resort or resort? Retreat or retreat? So you can see that the hyphen here can make quite a difference in the meaning of these words. As I said earlier, we do have a lot of exceptions to these rules, and the prefixes and hyphens are one of them. Many of our prefixes do not require hyphenations, such as preoperative or postoperative, mid-course or subcutaneous, non-lethal, non-drinker, antibacterial. But notice anti-Christian. Why? Because Christian is capitalized, it's a proper noun, so in that case we need the hyphen. So again, just to be aware, check it out on the dictionary if you need to. Most words beginning with pre-PRE and RE are not hyphenated, even when there are identical letters that follow it, like pre-eclampsia, double E's there. Check your dictionary. It's your rule, it's your authority, so take a look there if you need. The dash has a very different use than a hyphen, and how we do it on our word processor is to do 2 hyphens in a row on our keyboard, no space before, between, or after the hyphens, and it really does indicate a sudden shift in thought, and we don't use these very often in our writing. So here's an example. Dr. Kelly suggested, no, ordered, the patient see a specialist immediately. Notice where the hyphens are there. Really sets it off, really shows this sudden interruption in thought, and that's when our dashes would be used. And again, it's just a double hyphen on our keyboard, no space before, in the middle, or after. We can use a dash to summarize information. Tetanus, rubella, and diphtheria, dash. These are 3 vaccinations recommended for all children under the age of 5 years old. And here, just to take a little break in our punctuation rules, every once in a while in our lectures, I'll talk about proofreading to save your butt because we really need to proofread. Here was a sentence that was transcribed. Pain is better if she rests or takes a leave. That's not right. What do you think? Think about that a minute. Pain is better if she rests or takes a leave. When you're ready, click on the... Here's our answer. Pain is better if she takes a leave, as in the medication a leave. Needs to make sense. Remember, always, always that whatever we transcribe needs to make sense. Let's look at this. Dictated. I recommended sitz baths on the phone. That sounds kind of strange. How could the sentence be better? Maybe if we recast the sentence, right? On the phone, I recommended sitz baths. So you might need to recast that. Here's another one. Babinski reflexes were downloading. What do you think that is? And unless you maybe look up what Babinski reflexes is, which is the dorsiflexion of the big toe when the sole of the foot is stimulated, you may not know. But it should be Babinski reflexes are downgoing. Needs to make sense. Let's move along and take a look at the apostrophe. Remember that the apostrophe shows possession or ownership of something. It could be singular or plural. And here's an example. The patient's record is confidential. We're talking about one patient, apostrophe S. The record is the patient's. It's owned by the patient. The patient's records are confidential. Here we're talking about more than one patient. So it's S, apostrophe. So we have to pluralize it first and then put the apostrophe because it is the records of the patients. It's possessive. And here your clue word is or are. That's how you know if it's one or more. Now remember that apostrophes show possession. And one of the most common mistakes that I see from students is just putting apostrophes in words that are just simply plural. Such in walk-ins welcome. There's no need for apostrophe S there. The patient was ill. The patient's illness was severe. Here, patients is singular, so it is apostrophe S. It's the illness of the patient. The patient's illnesses were severe. Here we're talking about more than one patient. It's their illnesses. S apostrophe is called a plural possessive. So in this case, was and were, in those last two sentences, are your clue words if we're talking about a singular, one patient, or a plural, more than one patient. If we want to make a singular noun that ends in S possessive, we put the apostrophe after the S, such as Dr. Walker's office hours are posted. In this situation, Walker's is the last name of the doctor, not Walker. So we're going to S apostrophe. Sometimes we have irregular plurals, and with that, we just do apostrophe S if we need to make it possessive, such as a woman's watch. So one woman, apostrophe S. Women's watch. Women is an irregular plural, means more than one woman. It's plural already by the word women, so we add an apostrophe S. Children is another one. Children's Hospital of Milwaukee. Children by itself is already saying it's plural. So for in this instance, the hospital belongs to the children, more than one, so it's apostrophe S because children already is plural. Add an apostrophe after a plural noun ending in S to make it a plural possessive, such as the doctor's offices are located on the 3rd floor. We're talking about more than one doctor, so it's S apostrophe. Notice these examples of compound hyphenated nouns. The sister-in-law's concern was heard by the physician. We're talking about one sister-in-law, her concern, sister hyphen in hyphen law apostrophe S. Let's look at the next example here. The sisters-in-law's concerns were noted. We're talking about more than one sister-in-law, right? Because we have were as our key word here. There's more than one. We're going to pluralize sisters and still have the apostrophe S at the end. Sometimes we have understood or implied nouns that need the apostrophe S because we know it's possessive just because it's understood or implied, such as it was Dr. Green's stethoscope. The stethoscope belongs to Dr. Green, so it's apostrophe S. The stethoscope was Dr. Green's. Notice it still is an apostrophe S at the end, even though stethoscope comes before the name. And here are a couple of examples of two-person possession. Frank and Mary's auto was destroyed in the wreck. So here it was the auto of Frank and Mary. So we're going to pluralize, we're going to apostrophe S after Mary's, after the second person. Frank's and Mary's autos are both Buicks. So here we're talking about more than one car, right? We've got Frank's auto and Mary's auto. So we're going to apostrophe S both of them because they both possess the autos. Add an apostrophe S with abbreviations when it's possessive. Proofreading is the CMT's responsibility. It is the responsibility of the CMT, so it's possessive. They own it. So apostrophe S after CMT. And here are some personal possessive pronouns that do not require apostrophes. Hers, his, yours, theirs, ours, its. So take a look at those and read the examples that go along with that. And notice no apostrophes here. Let's take a look at the word its, ITS, versus its, IT apostrophe S, which is really very commonly misused. They're very different words. So ITS is possessive. Its biscuit remained buried for weeks. IT apostrophe S means it is. It's a complicated surgical procedure. Really meaning it is a complicated surgical procedure. So if we have apostrophe S, you need to look at that and rephrase it as it is. If it makes sense, then you need apostrophe S. Let's look at this a little bit further in the next slide. Using the same example from the previous slide, its biscuit remained buried for several weeks. If we use it as IT apostrophe S and we rephrase it, it is biscuit remained buried for several weeks. That doesn't make sense, so no apostrophe S. So whenever you choose to use IT apostrophe S, just substitute it for it is. If it makes sense, then yes, use the apostrophe S. If not, no apostrophe S. Let's do a little activity and test your knowledge here of our new its and its, if we need an apostrophe or not, with the following sentences. It's raining. Does that need an apostrophe or not? Yes, because we are really saying it is raining. It makes sense to say it is raining, so IT apostrophe S. How about the next one? Its cost is prohibitive. No apostrophe S here because then we would be saying its cost is prohibitive. Doesn't really make sense. So no apostrophe S in that one. Its outcome is in doubt. How about that one? No apostrophe S because its outcome is in doubt. Doesn't make sense. No apostrophe S. It's a matter of choice. Yes, apostrophe in this one. It is a matter of choice. Its reaction was negative. No apostrophe S here because we're saying its reaction was negative. Doesn't make sense. So I think you get the idea. Whenever you see its, to test it to see if you need an apostrophe S, just expand it out, it is, and substitute it and see if it makes sense. And be careful because Word, our spell check doesn't always catch these spelling errors or grammar errors. So be aware you need to know the difference. The next few slides will test your knowledge even further on the its and its issue with the apostrophe s or not. So here's our first one. It's apparent that the patient does not understand the medication regimen I've prescribed. Apostrophe or not? Yes, it is apparent. Apostrophe s. Number 2, because of no apostrophe in this one, because otherwise we were saying because of it is increasing size doesn't make sense. No apostrophe s in this one. If it's increasing size, the possibility of malignancy had to be considered. How about this one? Apostrophe s or not? Number 3, under the operating microscope, I was able to dilate the duct on the right, and after dilation, the gland resumed its normal size. Apostrophe s or not? Not on this one, because then we would be saying, and after dilation, the gland resumed its normal size. Doesn't make sense. No apostrophe s. Number 4, he states he had never had this pain before, and it's not occurred since. Apostrophe s or not? Yes, in this case we do, meaning it has. So most of the time it is, but sometimes we might need to substitute the words it has. So it should be an apostrophe s here. He states he had never had this pain before, and it has not occurred since. Apostrophe s. Number 5, the dog injured its foot. Apostrophe s or not? No, because otherwise we're saying the dog injured its foot. Doesn't make sense. No apostrophe s. Another reason why we might use an apostrophe is for a word formed by omitting some of the sound letters of a longer word, such as can't for cannot. So apostrophe 99 for 1999, she'll, she, apostrophe will, couldn't for could not. So in the most part, though, we are going to spell out contractions in medical dictation unless it's in a quote. Always spell it out. We also use an apostrophe when we talk about time, distance, and value, such as in a month's time. Month apostrophe s. We're talking about 1 month, so it's month apostrophe s. In 2 months' time, when it's more than one, we have to pluralize our month first, so months, and then put our apostrophe s at the end. We use apostrophes to form the plurals of capital letters A, I, O, M, and U, such as all students in medical transcription techniques and procedures received A's on last week's comma quiz. A apostrophe S. And this is to avoid some confusion, such as is, as, nis, us. So you can see that that's why we do the apostrophe S with those capital letters. We use apostrophes to form the plural of all lower letters, such as RX, apostrophe S for treatments. Z's, Z apostrophe S. Otherwise, it would blend together and it wouldn't be clear. Notice, though, the TMs were intact for tympanic membranes. In this situation, it's not one of the other capital letters that we need to have the apostrophe S in for clarity. So in this situation, uppercase, abbreviations, no apostrophe S. Let's look at the quotation marks. We're going to enclose exact words of the speaker in quotes. The ER physician said, quote, the cause of death was cardiac arrest, period, quote. Versus she said the cause of death was cardiac arrest, meaning it's just paraphrasing the speaker's remarks. Usually if a dictator wants something in quotes, they will actually dictate that. We'll also use quotation marks to call attention or single out special words or phrases. Amyotrophic lateral sclerosis, or ALS, is often referred to as, quote, Lou Gehrig disease, period, end quote. We also use it to set off slang, made up, or humorous words so that we realize that they are. Don't act like a, quote, psycho, period, end quote. Could we possibly see a, quote, well, quote, patient today? Notice that periods are always enclosed inside the end quotation mark, no matter how weird it looks. And to just reinforce what I said, that periods and commas are always placed inside the quotation marks, no matter how weird it looks. Sometimes it's going to look really odd to you, but always inside the quotes. She acted like, quote, the big cheese, period, end quote. Tell me, comma, quote, Mr. Know-It-All, comma, quote, how you arrived at that conclusion. So always commas, periods inside quotation marks. Semicolons and colons go on the outside. So nice and confusing, huh? Let's look at our parentheses. So along with commas and dashes, parentheses set off incidental or non-essential elements. Okay? When we talked about commas are used to slightly set apart closely related information. Dashes have this more forceful or attention-calling to our statements. Parentheses really de-emphasize material, even makes you almost think about skipping over it, and sometimes people do when they're reading, such as common over-the-counter substances, parentheses, aspirin, iodine, and hydrogen peroxide, and parentheses, can be purchased without a prescription. We can definitely just go right over those, and it won't really make any difference. Parentheses de-emphasize material. The slash mark or the diagonal is used in many technical terms when they're dictated. She has 20/20 vision. And notice that's just how it's dictated. Nobody says a slash or a dash or a diagonal. She has 20 diagonal, 20 vision. Blood pressure measured 120/80. So the symbol to use in place of the word over is the diagonal. The dosage is 5 milligrams per day. Again, we use that diagonal or that slash mark to substitute the word per. And or. And diagonal or. And you can look at the other examples there too, such as also the fraction, 2/3, 2/3, care of, C/O. So some of the rules about using a slash mark or the diagonal. And just a little lesson on dictionaries and spelling variants. If you look up a word, you might see something like archaeology or archaeology with two different spellings there. If you have the word or, it means that either one of those spellings is fine. If you have the word also in between the two spellings, it means that the first spelling is preferred, such as judgment without the E is preferred over judgment with the E. And you might also see also in between each one, and that means that either one is fine. And this will conclude our miscellaneous punctuation lecture for this week. I know we covered a lot of information and there's a lot of rules and exceptions to note, so make sure that you go through the textbook, make sure you're doing your self-studies and all the information along the way. You might also be interested to know and try some of these interactive quizzes that I've put out on the web links area of our Blackboard site. Just gives you some extra information and extra practice on some of the rules that we've learned. Thanks so much for listening, and we will see you next week for our next chapter.